International health organizations. Overview of major international health organizations. WHO, UNICEF. Major international health organizations play pivotal roles in improving global health, combating diseases, and ensuring access to healthcare for all. Key organizations include 1. World Health Organization WHO, role as the leading global health authority under the United Nations. WHO sets international health standards, coordinates responses to health emergencies, and provides guidance on public health policies, activities. 2. United Nations International Children's Emergency Fund UNICEF, role primarily focused on children's health, education, and welfare. UNICEF works to ensure that every child has the opportunity to survive and thrive. Activities. Vaccination programs implements immunization campaigns to protect children from preventable diseases. 3. Médecins Sans Frontières MSF, Doctors Without Borders, role an independent humanitarian medical organization. MSF delivers emergency medical aid to populations in crisis, regardless of race, religion, or political affiliation. Activities. 4. The Global Fund to Fight AIDS, Tuberculosis and Malaria, role a partnership organization dedicated to accelerating the end of AIDS, tuberculosis, and malaria as epidemics. Activities. Funding programs provides financial support to countries for prevention, treatment, and care initiatives. 5. Gavi, the Vaccine Alliance, role a public-private partnership aimed at increasing access to immunization in low-income countries. Activities. 6. Pan-American Health Organization PIHO, role the regional office for the Americas of WHO. PIHO works to improve health and living standards in the Americas. Activities. 7. Bill and Melinda Gates Foundation, role although a private foundation, it is a major player in global health through funding and innovative health solutions. Activities. Impact and significance. These organizations collectively enhance global health by addressing a wide range of issues, from infectious diseases and health emergencies to maternal and child health and health system strengthening. Their collaborative efforts, substantial funding, and expertise drive significant advancements in public health, saving millions of lives and improving the quality of life worldwide. Through coordination, innovation, and unwavering commitment, major international health organizations continue to tackle the most pressing health challenges, fostering a healthier and more equitable world for all. B. Roles in global health governance, disease control, and vaccination programs. Roles in global health governance, disease control, and vaccination programs are critical for maintaining and improving worldwide public health. These roles are typically carried out by a combination of international organizations, national governments, NGOs, and private sector partners. 1. Global Health Governance, World Health Organization WHO, Leadership and Coordination. WHO sets international health standards, coordinates responses to health emergencies, and facilitates collaboration among member states. Policy development. It formulates guidelines and policies on various health issues, ensuring consistency and best practices globally. Monitoring and evaluation. WHO tracks global health trends, disease outbreaks, and the effectiveness of health interventions. Through comprehensive data collection and analysis, United Nations UN agencies, UNICEF, focuses on child health, nutrition, and access to clean water and sanitation. Gavi, the Vaccine Alliance enhances access to immunization in low-income countries. Through funding and partnerships, the Global Fund provides financial support to combat AIDS, tuberculosis, and malaria by funding prevention, treatment, and care programs, disease control, surveillance and response. Early detection organizations like WHO and national health agencies monitor disease patterns to identify and respond to outbreaks swiftly. Containment strategies implementing measures such as quarantine, contact tracing, and travel restrictions to limit disease spread. Research and development, vaccine and treatment development, collaborative efforts between organizations like the WHO, CDC, and pharmaceutical companies to develop vaccines and treatments, funding and support providing resources for research initiatives targeting emerging and reemerging diseases, health education and promotion, awareness campaigns educating the public about disease prevention, hygiene practices, and the importance of vaccinations, capacity building training healthcare workers to effectively manage and control diseases within their communities, vaccination programs, vaccine distribution and access, logistics and supply chain management ensuring vaccines are stored, transported, and distributed efficiently to reach all populations, including remote areas. Affordable pricing negotiating with manufacturers to provide vaccines at lower costs for low-income countries through initiatives like COVAX, immunization campaigns, mass vaccination drives organizing large-scale immunization efforts to achieve herd immunity and eradicate diseases such as polio and measles. Routine immunization, integrating vaccines into regular healthcare services to maintain high coverage rates and prevent outbreaks, monitoring and evaluation, tracking coverage using data systems to monitor vaccination rates and identify gaps in coverage, assessing impact, evaluating the effectiveness of vaccination programs in reducing disease incidence and improving public health outcomes. Collaboration and partnerships, effective global health governance, disease control, and vaccination programs rely on strong partnerships between international organizations, governments, NGOs, and the private sector. Collaborative efforts ensure the sharing of resources, expertise, and best practices, enhancing the capacity to respond to health challenges comprehensively and sustainably. 3. Challenges and responses to global health emergencies. Global health emergencies, such as pandemics, natural disasters, and outbreaks of infectious diseases, pose significant threats to populations worldwide. Addressing these crises involves navigating numerous challenges and implementing effective responses to mitigate their impact. Challenges: rapid spread and transmission, limited healthcare infrastructure, coordination and communication, funding constraints, misinformation and public trust, logistical challenges, responses, international cooperation and coordination, rapid response teams, funding mechanisms, public communication and education, technological innovations, strengthening healthcare systems, vaccine development and distribution. Conclusion: addressing global health emergencies requires overcoming significant challenges through coordinated, well-funded, and innovative responses. By fostering international collaboration, enhancing healthcare infrastructure, combating misinformation, and leveraging technology, the global community can effectively manage and mitigate the impact of health crises, ensuring better preparedness and resilience for the future. 4. Globalization and international health organizations. Globalization profoundly influences international health organizations by enhancing their ability to address health issues that transcend national boundaries. As the world becomes more interconnected through increased trade, travel, and communication. Health threats such as pandemics, chronic diseases, and environmental hazards can spread rapidly, necessitating coordinated global responses, enhanced collaboration and coordination. Globalization facilitates collaboration among international health organizations, like the World Health Organization WHO, UNICEF, Médecins Sans Frontières, MSF, and the Global Fund. These organizations can share information, resources, and best practices more efficiently, enabling swift and unified responses to health crises. For example, during the COVID-19 pandemic, WHO coordinated global efforts in tracking the virus, disseminating guidelines, and facilitating vaccine distribution, resource mobilization, and funding. Global interconnectedness allows for the mobilization of financial and human resources from around the world. International health organizations can leverage global partnerships, donor networks, and multinational funding mechanisms to support large-scale health initiatives. Standardization of health practices. Globalization promotes the standardization of health practices and policies. International health organizations develop and disseminate guidelines and standards that member countries adopt, ensuring consistent quality of care and public health measures. Technological advancements and innovation. The global exchange of technology and innovation accelerates advancements in healthcare. International health organizations utilize digital health tools, telemedicine, and data analytics to improve disease surveillance, treatment delivery, and health education. Challenges of globalization. Despite its benefits, globalization presents challenges for international health organizations. Addressing inequities and strengthening resilience. International health organizations strive to address global health inequities by focusing on vulnerable populations and ensuring equitable access to healthcare services. Globalization enhances the capacity of international health organizations to tackle complex health issues through improved collaboration, resource mobilization, and technological innovation. However, it also necessitates addressing challenges such as cultural differences and resource inequities by leveraging the benefits of globalization while mitigating